Hello, Rebecca Kelly here, nurse practitioner from AIYANA Aesthetics. I just wanted to hop on here today and talk to you a little bit about the neuromodulators that we do have in our clinic. So as of right now, we do carry Botox as well as Dysport. And we get asked a lot, what is a neuromodulator? What is the difference between the brands? I want more information. So essentially, a neuromodulator is what we like to also refer to as a wrinkle relaxer. So what it does is once it is injected, it actually goes into the chemical synapses of our muscles and it blocks that from allowing our muscle to contract. And by doing so, it then relaxes obviously the muscles, but then it also relaxes the movement of the skin and what you can see that might cause a wrinkle. So we love using neuromodulators in our clinic. One is an anti-aging plan, but also as a preventative medication as well. And the reason being is because if you relax those muscles, you will not be making those expressions anymore. And by doing so, you're not causing that skin to create that wrinkle in that space where it would normally create if you were making those movements. So we're seeing a lot of younger patients these days come in who want to start preventative Botox or Dysport, and that is a great option. You don't have to use very much of the product. We sometimes refer to it as baby Botox, where it's really just softening the skin and also just slightly relaxing the muscle. So you still have the movement in those areas, but it's not going to create that deeper wrinkle as time goes on. So it's a great option for that. It's also great for anybody really who's looking to just soften those wrinkles and fine lines and to prevent that movement from creating deeper wrinkles and fine lines. So what is the difference between Botox and Dysport? Well, honestly, they're very similar. They have the same main active ingredient in them. Dysport has a little bit more of the actual active ingredient than Botox does, so that differentiates them in the sense that sometimes people will notice Dysport will start working a little bit sooner, usually within 3 to 5 days, sometimes up to 7, instead of the 7 to 14 days like it takes for Botox. The other thing that people notice a lot is that it's a little bit stronger than Botox, which, if it has more of the active ingredient, naturally that's probably going to be the case. But because of that, sometimes it'll last a little bit longer too. A lot of people will say, my Dysport seems to last, a little bit longer than the Botox. But everybody's different, and when we prescribe Botox or Dysport to a patient, we're really taking into consideration the patient, their medical history, what have they used in the past, what has been the most effective, and everybody has different response to these medications, just like they would with any other medication. I like to explain it in the sense that, when you think of allergy medication, every few years you have to switch it up because one just stops working. Botox and Dysport is kind of the same. After a few years of using the same product, you might want to switch it up. So that's why we carry both. Not one is better than the other. I don't have a preference in one or the other, but I do like having both on hand just for the reasons I discussed, and also it's good to be able to customize our treatments to our patients. So I hope you enjoyed this video. Be sure to check back here often. You can like the video and subscribe below if you want to hear from us some more, and we hope you have a good day.